India being a patriarchal society, the parents are obviously worried that their daughter will not get married, and they will try to cover it mostly.
Hello and welcome to Dr. Story, everyone. Epilepsy, more often known as fits, is a disorder of the brain characterized by repeated seizures. A seizure is usually defined as a sudden alteration of behavior due to a temporary change in the electrical functioning of the brain. And according to the World Health Organization reports, it is affecting more than 50 million people worldwide. But being a woman with epilepsy is not the same as being a man with epilepsy. Although it's equally prevalent, however, for women, there are unique concerns related to sexual development, menstrual cycling, aspects of contraception, fertility, and reproduction. Management of women with epilepsy thus requires special attention and awareness with these considerations. Today's expert doctor is Dr. Shubha Subramanian. She completed MD in General Medicine in 2014 from Sri Balaji Medical College and Hospitals, affiliated to Bharat University, Chennai. Thereafter, she completed DM Neurology in 2018 from Madras Medical College, affiliated to the Tamil Nadu Dr. MGR Medical University, Chennai. Currently working as a consultant in Department of Neurosciences at Dr. Rella Institute and Medical Center. Her major area of interest is women suffering from epilepsy. Doctor, it's so great to have you here. Thank you for joining us.
Thank you for inviting me.
So, Doctor, getting straight into the topic, what are the practical issues faced by dealing with women with epilepsy?
Okay, so generally both men as well as women suffer from epilepsy, but I feel there are more amount of social issues when it concerns women. So I feel a neurologist has to be more compassionate and empathetic towards a lady having seizures and have a little bit of more understanding. And it's beyond just medical management. It would be better if you can also counsel the relatives of the patient who's suffering from epilepsy.
Okay. And now, when we talk about the practical issues faced by the women themselves, what are those?
Yeah, so as I already said, we have a strong social stigma against epilepsy in our society. For the lay people, epilepsy means having fits. So a lady having fits goes through the disease and also the social stigma associated with the disease. If you see, starting with the parents, they themselves would be scared or ashamed to tell their relatives or friends that their own daughter is suffering from epilepsy. So a girl suffering from epilepsy has to go through the process of suffering from the disease and also the social stigma associated with the disease. Her own parents would be scared or ashamed of sharing it with their relatives and friends. And the girl would also not want to reveal it to her friends. So because of all this, they are scared, they feel helpless, because of which they don't come to a doctor on time. So these are some of the problems leading to poor quality of life, increased episodes of seizures. If they had gone to a healthcare person at the right time, they could have dealt with that in a better way. And when it comes to the Indian society and mentality, the parents would be scared that their daughter would not get married because of this particular reason. This can also lead to interpersonal problems with the spouse, the in-laws, all such things.
So overall, the quality of life decreases, right? When we talk about the relationship between the social stigma attached to it and quality of life.
Yeah, definitely the quality of life is not great compared to other people, basically because of the severity. It depends on the severity of seizure, the frequency of seizure. Are they on treatment for it? Are they taking the drugs properly? Because if you see, there are a lot of people who have very poor drug complaints. no one wants to take the tablet for years. So when the seizure frequency and severity is more, it obviously leads to poor quality of life. On top of it, these patients will also have associated mood disturbances like anxiety, depression. They can have associated headaches. All these things can lead to a poor quality of life. This, in addition to the social stigma, leads to a lot of problems. So their quality of life can be better if they do not think that they are dealing with a major life-threatening disease and if they take medical help on time.
Right. And what do you think are the gender-specific challenges in the management of epilepsy?
Yeah, so there are a lot of gender-specific challenges. India being a patriarchal society, the parents are obviously worried that their daughter will not get married and they will try to cover it mostly. Leads to issues with the husband, leads to issues in sexual life. The girl has difficulty in adjusting with the in-laws. And if you see, there are a lot of women neurologists who've been passionate about this subject. They've done studies on all these things. And they found out that most of the times, the spouse over a period of time, if not immediately, tends to understand the gravity of the situation. But then it becomes difficult for the in-laws to accept to this idea. But all I would say is, if the relationship between the husband and wife is good, over a period of time, the husband helps the wife in dealing with this. This is one gender-specific problem. I don't think any man with epilepsy has ever felt the need to explain it to the wife or his in-laws. And the next thing would be in dealing with her pregnancy. Obviously, she would be scared. So pregnancy, childbirth, lactation, she would be worried whether her child will get affected with seizures. She would be worried whether the child can have some birth anomalies. These are very gender-specific changes or gender-specific battles that a lady with epilepsy undergoes.
As you were mentioning about the reproductive health, I think that's the major thing that gets affected.
Definitely.
So what about women in, again, childbearing stage? If you could elaborate more on the issues related to, as you mentioned, contraception, pregnancy or lactation.
Okay. Yeah. So it starts with contraception. Already our society is not very friendly towards oral contraceptive pills. So now they would be all the more worried because they're already on anti-epileptic drugs. So they would be worried if at all they take oral contraceptive pills, whether the seizure frequency will increase. Definitely taking OCPs will not lead to increase in seizure episodes. But what can happen is there can be drug interactions between OCPs and anti-epileptic drugs leading to either a contraceptive failure or a breakthrough seizure. But one need not be worried because of this, because if you go to your doctor at the right time and if your neurologist and gynecologist can discuss and give you a prescription, all these things can be avoided and you can have a good contraception as well as good seizure control.
So what's the impact of maternal epilepsy on delivery or neonatal outcomes? As we discussed about the pregnancy or the contraception, what happens post-delivery? How they manage that?
Neonatal outcomes, yes. So what we say is women suffering from seizures, when they go through their pregnancy, we call them seizure complicating pregnancy. So these are little high-risk candidates. High-risk in the sense, I mean that their visit to the gynecologist should be more frequent compared to a lady who does not have seizures and is pregnant. And there should always be consultation with the neurologist and more visits with the neurologist at this point of time. So during pregnancy, they can have an increase in the number of seizure attacks. And coming to the pregnancy itself, they're prone for abortions, they're prone for miscarriages, there could be preterm deliveries. Sometimes the gynecologist may decide that they can plan for an elective cesarean section if the seizures during pregnancy comes with more frequencies. As far as the child is concerned, the child can have teratogenic abnormalities, But if you really look at it, if you have a proper consultation with a gynecologist and neurologist, you're on the right kind of medication, your seizure is controlled, and if a patient is on multiple anti-epileptic drugs, if there is a change prior to the pregnancy, the neonatal outcomes are much better. The child need not have birth asphyxia, that is difficulty in breathing after birth. And we say something called Apgar scores. Immediately when the child is born, we score the child and see whether they have a good score, which means good outcomes. So sometimes the Apgar scores may be less. The child can also have birth anomalies, but all these things can be handled excellently if there is a good hospital visit from the patient side. Many of the times you see complications when people do not come and consult the gynecologist or the neurologist or the right time and stick to their own old prescription. Correct. You would actually be surprised because you think that nowadays people are more educated, their awareness is more, so you think they would come to you for help at the right time. But I'm sorry to say, I'm practicing in a metro like Chennai, wherein the literacy rate is good, the awareness is good, in spite of which my patients would come to me after pregnancy while they're on medications. They would have been forced by their gynecologist to come to me for drug adjustment. They would definitely not come of their own accord. There's a very, very little percentage of patients who come on their own accord, in spite of us telling them prior to their marriage that, they should be little cautious about all this.
What is this? Is it just ignorance from that part? It's so sad yet true. Like, we have to accept it on the face value itself, but avoidance is it, or ignorance? But right time and the right treatment, I don't know what's lacking.
It's a lot of difference. Yeah, I think it's a combination. It is little ignorance. It is also a lot of avoidance behavior. They actually do not want us to say anything. They just want to block it out and just do the thing that they want to do.
Now, if we talk about the general treatment, if you could shed some light on that part, and how does that differ for men and women?
So basically, when it comes to treatment, there is not much of difference between a male and a female in the initial stages. The change comes only during pregnancy. So we would like to actually counsel the patient prior to planning their pregnancy only. For example, there are few drugs that need to be avoided during pregnancy. So if at all the patient is on drugs, they're already on drugs that should have been avoided during pregnancy, then we try and change it prior to the pregnancy. That would be one of the things. The other thing would be, generally during pregnancy, we prefer monotherapy. That is, it is ideal, but it may not be possible at all times, but ideal to be on a single drug and at the lowest minimum dose, which can prevent seizures, but may not be possible at all times. But that is up to the practicing neurologist to decide what works for the patient better. So in that way, yes, few drugs should be avoided in women compared to men.
And do these anti-epileptic drug or other medications that you mentioned have some rare side effect on women's health?
Yes, they do have. Some of the common side effects would be nausea, excessive drowsiness, mood fluctuations, swollen gums, and over a period of time, some cognitive decline. But I don't think, generally we prescribe a drug based on the risk-benefit ratio. So if the benefit is more than risk, then we explain about the side effects and insist that they have to take the medication. But sometimes there are rare side effects wherein the risks are more and you try and stop the medication and see whether we can shift to some other drug. So those will be one thing is Stevens-Johnson syndrome. It's a technical term. This causes changes, extensive changes in the skin and mucosa, and can sometimes even lead to death. So sometimes the rare side effects of anti-epileptics, not all the drugs, few anti-epileptics can lead to Stevens-Johnson syndrome. And there's this drug called sodium valproate, which over a period of time can lead to chronic liver failure. And same way, few anti-epileptics can cause teratogenic abnormalities in the child, wherein the baby born while the mother was on all these drugs can have cleft lip and palate, wherein the palate and the mouth would be abnormal. They can have congenital heart diseases. So in these instances, we try and change the medication.
So does these have an impact, right, on family planning, or we talk about menopause, or we talk about menstrual related? These have the direct impact, is it? All the drugs?
Yeah, definitely. Both the disease as well as the drugs have an impact. Yeah. For example, there's something called catamenial seizures, which means during the time of menstruation, the number of attacks increase. So for such patients, we generally put them on some drugs, and during menstruation alone, we try and add another medication so that it covers the menstrual period. So that is one thing. Coming to menopause, generally seizures can increase during the perimenopausal period because of the hormonal changes, and post-menopausal you can actually get relieved, especially in case of catamenial seizures. And when it comes to family planning, we would suggest barrier contraceptive methods rather than OCPs as the first line. But then if at all OCPs have to be tried, then there are few drugs which are enzyme inducers and which can lead to contraceptive failure. We try and avoid them and move on to drugs that do not have this effect. Some of the newer anti-epileptics are not enzyme inducers. They do not have any interactions with the oral contraceptive pills. So we try and prescribe them. But if at all we have to prescribe enzyme inducing anti-epileptic drugs, then we try and adjust the OC pills accordingly.
Finally, if you could guide us about the best practices or habits, lifestyle changes for the management of women with epilepsy.
So yes, as I said, again, both the disease as well as the drug has an impact on a lady's sexual development, her menstrual cycle, fertility, reproduction, aspects of contraception, as well as family planning, pregnancy, and care of children, of mothers with epilepsy, and I left breastfeeding. So both the disease as well as the drugs have an impact on all this. So what we would suggest is, generally in women, go for a pre-conception counseling. Discuss about your future pregnancies. Do you require a prenatal screening? Genetics of the seizure. What are the risk versus benefit ratio of taking the anti-epileptic and not taking the anti-epileptic? Should you take supplementation in the form of folic acids, vitamin K supplements during pregnancy, after your delivery? And how should you plan your labor? Should you go for a normal delivery or should you go for a planned cesarean? How about breastfeeding? Generally, some people may not, some women are of the misconception that they cannot breastfeed. It's absolutely wrong. We encourage them to breastfeed, and there is very little quantity of the drug that gets excreted in the breast milk. And again, monotherapy and lowest drug during pregnancy, and care of the children of mothers with epilepsy. That depends on, again, the seizure type, the seizure frequency, and the severity, but studies generally have not found any major differences. Only thing is, the caregivers need to be educated a little bit more. And if you stick to your doctor visit properly and stick to taking your drug properly, you can actually have a beautiful pregnancy, labor, and a good postpartum period.
Well, you shared such a detailed insight into a woman's life addressing epilepsy. Truly appreciate the time you took off. Thank you so much.
Thank you. So before signing off, I just want the public to be aware about the disease. It's not that the disease should never limit any individual, man or women, and all the more women. They should not think that the disease is going to hamper their personal life, their professional life. They can achieve heights. There are very many successful women who have handled their epilepsy beautifully and have achieved greatness in both their personal and their professional life. And the public should stop seeing this as a social stigma. Instead, they should be empathetic and compassionate towards such women so that more and more women come out with the disease and take health care help at the right time.